All right, team. We have a patient presenting with symptoms of acute bronchitis, phlebitis, and chorioamnionitis.
What are your thoughts on the diagnosis?
I think it might be a case of acute bronchitis causing respiratory distress.
I'm inclined to agree with Gary, but I also see signs pointing towards phlebitis.
I believe chorioamnionitis could be the primary issue here, especially considering the patient's medical history.
I'm thinking it could be a combination of phlebitis and chorioamnionitis, affecting the patient's respiratory system.
Look, if I wanted people just repeating what I said, I'd ask for bots. It's carnitine. Acylcarnitine translocase deficiency. There's no room for debate on this one.
But, Dr. Hawks, are you sure? Acylcarnitine translocase deficiency is quite rare?
I don't care how rare it is. We need to act fast. All of you will perform metastasectomy on the patient. It's a risky procedure, but it's our only shot at saving their life.
Metastasectomy? Are you serious, Dr. Hawks? That could kill the patient?
I make the calls here and I say we do it. Now suit up. We don't have time to waste. Tracy, thanks for calling me in. I need your approval to perform a metastasectomy on my patient with carnitine. Still carnitine translocase deficiency.
Hawks, I understand your eagerness to help your patient, but are you sure about this diagnosis? You've had a history of misdiagnosing rare conditions.
There's a reason things are called history, and things people care about are in the present and future.
Hawks, I just want to make sure we're making the right call. Your track record speaks for itself.
The track record. The track record. You sound like a broken track record.
I need you to be absolutely sure before we proceed with such a serious procedure. Let's review the case one more time before making a final decision.
Patient sick, patient need operation. I go now.
No. The patient is in critical condition. This is not looking good at all.
I can't believe that metastasectomy wasn't the right treatment for acylcarnitine translocase deficiency. Dr. Hawks was so sure about it too.
He's a moron.
Only on Tuesdays. Maybe we can try a different approach, like enzyme replacement therapy. I think there's still hope for the patient.
What does only on Tuesdays mean?
It means something that is a pattern occurs on Tuesday every week.
I'm about to toss you out of this window back into Monday.
Thanks, that'll give me time to get my car off of the handicapped parking space at the hospital. Some of the patients are getting pissy about it.
Oh, I wonder why.
Probably because my car is big enough to take up 3 of those spaces.
What the hell were you all thinking? Almost killing our patient with a misdiagnosis of carnitine. Acylcarnitine translocase deficiency and that unnecessary metastasectomy? Are you all Ronald McDonald College rejects?
No, just Frank. The rest of us got rejected from Prager U.
How do you get rejected from a video platform?
They wouldn't take my credits I earned from my time served in the state penitentiary.
That's off topic. Let's redirect your stupidity on the patient. The topic.
The patient didn't have a formal education.
Neither do you apparently because you spoke in past tense. The patient is alive and in critical condition.
Finally, thank you, Randall.
I was starting to worry that every single one of you best qualified for a condom commercial.
That's not the expression. I remember your dad saying you were a pro-choice poster child.
Every time I open my mouth, my remaining brain cells atrophy and fall to the floor, listening to you fools. Figure this mess out yourselves. So, how are things going in the oncology department, Johnson?
Pretty good, actually. We've been making progress with some of our patients. It's always tough, but seeing a positive outcome makes it all worth it.
That's great to hear. Speaking of patients, I've been trying to crack this perplexing case for days now. It's like a puzzle that's missing a few pieces.
Oh, I know the feeling. Sometimes it takes a while to see the bigger picture. Hang in there, Hawks.
Wait a minute. I think I've got it. It all makes sense now. Thank you, Johnson. I need to go check on my patient right away.
Wait, what, Hawks? Where are you going? What about lunch?
Walking away. Sorry, Johnson. Duty calls. I'll catch up with you later.
Duty.
Sorry, but we don't have time to waste. We're dealing with something new here.
Hawks, you can't just barge in like this. Where's your protective gear?
This is serious, Hawks. You need to follow protocol. You're putting everyone at risk.
Listen, I figured it out. It's not carnitine. Acylcarnitine translocase deficiency. It's horizontal transmission.
Horizontal transmission. What's the prognosis for that?
The prognosis is actually better than we thought. It's treatable with the right course of action.
But how did you come up with this new diagnosis? During lunch with Dr. Johnson?
Yes, exactly. Dr. Johnson and I put the puzzle pieces together over lunch. I'll explain the details later, but trust me, we're on the right track.
I'll get the transmission fluid ready. Frank, pop the clutch, Randall stick it in neutral, and Leslie get the bedpan.
I hate to ask, but when you say stick it in neutral, just what are you referring to?
You ever pitched a tent?
Randall, why the hell do you feed Gary stupidity? The rest of you, put Gary in park and take the keys out. Forever. Thanks, Tracy. It was a tough one to crack, but I'm glad we got it right in the end.
You did a great job, Hawks. The patient is lucky to have you as their doctor.
Oh, I know. If it wasn't for me, my 4-pack of morons would be taking him for a test drive right now.
What is that supposed to mean?
I don't feel comfortable coming up with a euphemism based on your dating history right now. Good night.